two of my memberships that would have to do with legislation.
Thank you so much. Tiffany Corbett, would you mind introducing thank you.
Sure. I'm Tiffany Corbett. I am representing the IT department, but I don't currently sit or am involved in any committees that have a legislative impact.
Thank you. DC Hadley.
Greg Hadley representing fire, and affiliation would be through the Oregon Fire Chiefs Association. That would be the only affiliation that would have a direct impact.
Thank you so much. Jason Pulley.
Hi, Jason Pulley with Public Works Department in utility planning, former chair of the Oregon Water Utilities Council and the current vice chair of the LSC's Water and Wastewater Policy Committee.
Jessica Blakely is not with us just yet, and she is both a member of the Salem Housing Authority leadership team, and she does have quite a bit of knowledge and awareness of everything that's happening in the housing world. It's amazing how tapped in she is with everything that's going on. And then Josh Eggleston is also our budget officer, and he's been participating, and he's not with us today. And then we have Mina Hansen, who's from Human Resources and very tapped into all of those issues that are going on. And Eunice, do you want to do an introduction, please?
Eunice Kim, representing Community Development. I'm also the new chair of the Legislative and Policy Affairs Committee for OAPA, the Planning Association.
Thank you, Eunice. Sarah Long is not with us today, and she is the co-chair of the Oregon Economic Development Association Government Affairs and Legislative Committee. She's also part of our team from Urban Development and Economic Development. Marcus Pitts is not with us today either, and he's Human Resources, as you know, does quite a lot with our risk and is highly tapped into all of the legislative matters. Mark Weinstein.
Thank you. Mark Weinstein. I'm an assistant city attorney. My clients include the police department, the fire department, code enforcement division, the IT department, as well as the library. And on top of that, do a lot of general public records work for the city. My professional affiliations include I'm a member of the Oregon City Attorney Association, and I also have a relationship with the Oregon District Attorneys Association based off of numerous years doing prosecution work, and do have membership with the Oregon League of Cities as well.
Thank you, Mark. And then Ryan, could you round us out, please?
I'd be happy to. So I'm Ryan Zink. I am a budget analyst, but you probably know me better as a franchise administrator for the city of Salem. I am currently a vice chair with the League of Oregon Cities Legislative Telecom Policy Committee. I'm also a member of NATOA, which is the National Association of Telecommunications Officers and Advisors, which is a mouthful. And also on the Oregon chapter of NATOA, and also am very recently a new member of what's called SWAMAC, which is the Marion County Solid Waste Management Advisory Committee, and I'm representing local organizations on that committee. Or excuse me, it's called a council, so I'm on that.
Thank you so much, Ryan. And I want to just be clear, you know, as we are all out in our professional associations, what we are doing, we are not formally representing the city unless that appointment has been made directly in that way. And then when we are out providing testimony, we are clear to be representing the city or the affiliation, not both at the same time. It gets very confusing. So I just wanted to make sure that you had a deeper understanding of all of the ways in which we're tapped into various legislative matters. So thank you for that time. I think the next step, Mayor Bennett, if you're amenable, is to hear from Justin with a legislative update. And you all received a memo in your packets to kind of bridge the gap between when we were talking about meeting and when we met. So Justin, would you mind?
Thank you, Courtney. Well, Mr. Mayor and members of council, as Courtney mentioned, you guys got this memo, so we won't spend much time going through it, but I think it's good because it gives you a sense of what legislative days are about and what the specific committees are meeting on. Obviously, economic development met, healthcare, housing, liability and workforce. There's also today a joint Senate Finance and House Revenue meeting looking specifically at medical liability and what happens or what comes out of that work group. Those groups began following that first special session. Then, of course, public safety, revenue finance, water, Peter testified this week, and then wildfire. So we know in terms of next steps that the legislature will meet again for legislative days, December 7th through 10th in 2020. Then there'll be another meeting in January before the session starts up. The legislative session begins on February 1st. And as you guys know, it can go no later than July 11th, 2021. We will see a lot of things that came up during the walkouts, both in the 2019 session and in the 2020 session. And as Courtney gets into our legislative priorities, we can certainly discuss those. And as we prep going into the next legislative session, we will also look back at all our tracking so we have a good sense of what's coming. You guys will ultimately hear about what we think is on the horizon as we get closer to that legislative session. So with that, that was the memo specifically. Special session. Now, I'd love to sit here and be more concrete, but last week I heard there will be no more special sessions. And then of course, early this week, now they're talking about special sessions. So I will try to get more information on that since the revenue forecast was up due to help obviously with federal aid. As former legislators on council would know, more money, more issues and more requests of the legislature. So we will keep an eye out. And if anybody hears before we do, please let me know. But we've got our ear to the ground hearing if there will be a special session now that the revenue forecast is up. As I mentioned, it is actually up, but it's not up as much as was predicted pre-COVID, as can be expected, but it is still up because of that federal aid. We do know specifically that that will catch up at some point. So as we look to the future, 2 years down the road, 3 years down the road, we need to have that thought in the back of our mind that we might be looking at some tough times coming up. We also know that low wage workers are really kind of bearing the brunt during COVID. So expect to see that. In terms of housing, we know we'll be looking at concepts of urban growth boundary, affordability, and availability of housing. We know that'll continue in 2021. Public safety, as Deborah can attest to, we think we will see a lot of legislation that came out of what's been going on both nationwide and in and around our state. So we know we're going to continue to do that. We'll have more information from the liability work group update, again, which I mentioned is being held today at 1. We know we're going to see more water issues, and Peter did testify to some of our challenges. We know that committee bills will be coming back, so I would imagine big ones, much like cap and trade, cap and invest, and other things that we saw during the walkout. We know we will face those again. And I would think as an overall, and you guys are probably getting a good sense of this as well, with the Democrats in control and in real majority control in both chambers, it seems, or it has been stated, that every policy issue is also going to have an overlay of an equity lens. So we know the legislature, we know the governor's priority, we know the legislative leadership's priority is how do we get funding to those communities that really need it? How do we look at this in terms of equity? And that's really going to be a focus. Now, again, that has been a focus of Democrats, but we know that it's going to be an additional overlay. So in our thinking, with any legislation that we see coming down the pike, we should know that that policy directive has been put out there from the governor and legislative leadership. And then finally, Mr. Mayor and councilors, I would say, just looking at the general political landscape, and again, this is your government relations specialist, lobbyist, whatever you want to call me, predicting things 6 weeks away from an election, but I don't see any way for the Republicans to take control of either chamber. And in the areas where they do have a shot, I think they have some very vulnerable members of their own. So I'd say at a bare minimum, we're going to see numbers probably remain the same, about 18-12 in the Senate, and the supermajority again in the House as well, unless something strange happens. But we're going to see a large turnout election, as most of you know. General elections tend to do that. So I think we know our leadership. We've done a good job of focusing on our leadership, and really with the help of the Senate President's office, as well as leadership in the House, we've been able to accomplish quite a bit. I intend that those situations and leadership situations will stay the same. And I look forward to us having as you'll hear in a few minutes, a real nice, tight legislative agenda in very difficult times that'll allow us to be successful, but not get too spread out to where we don't see any success. We can really focus on those core issues. So with that, Courtney, that's my legislative update. And again, weird times, especially prior to election. We're still getting a lot of phone calls about campaigns, but really haven't had the opportunities to do face-to-face. So I know Nikki is working on those meetings here for what we call goodwill in this business. And we will be having quite a few face-to-faces, whether it's a Zoom call or whether it's a 6-foot distance here in the next month. So that's where we're at legislatively.
Any questions
Yes.
for Justin?
Questions, yeah, thank you.
Justin, the governor signed our water. She did not veto our water. There was some discussion of that.
Very nerve-wracking. Everything we've been through, right? We were done. We got it. No, we don't have it. Yeah, we were kind of on pins and needles there for a while, but we're okay.
None of the growth in the fiscal situation at the state is a result of economic activity. It's really a function of federal action. Is that what you're telling us?
Yeah, that's the way I understand it. But I haven't really, dove in deep. That was just from the forecast on Wednesday. So if I can get more information, Mr. Mayor, I will definitely do that.
Okay. Yeah, Tom.
I'm sure this is on everybody else's minds too. We'd love to get the money for our sobering center, and whatever you can do to move that along, that would be terrific.
Well, we've got a sobering center. What we don't have is staffing for a sobering center. We have a commitment from Kaiser, their standard $5,000, and nobody else is stepping up. So I think that's going to be, a lot of that's going to be on us trying to find that sustainable funding mechanism for operations for at least 5 years. I don't know how else we can proceed to open that, but that's the problem.
Mr. Mayor, are you referring to the piece of property that we were talking about buying?
No, I'm referring to the built sobering center we have
Okay,
at Arches.
Okay, then
Now,
maybe,
we got one, we just don't have the staffing. It's a problem.
then I'm sorry, what I think I should have said is maybe the low belt barrier shelter. I mean, there was.
There you go.
that I
That's
meant.
the one. I thought that's what you might have meant.
Yeah, well, it is, and now everybody knows what I meant. Yeah, so that's the thing that we're really concerned about is the funds to purchase that building.
Forget how much we had on the table for that. Do you recall? Yeah, go ahead, Justin.
I think it was 5. And as I mentioned earlier in the ledge update, the concepts that were on the table when the legislature walked out, when the Republicans walked out, we were in the queue for that funding. And I think it was about 5 million total, which could cover operations. We had it expanded. So
Right.
we are certainly in there with
Okay.
some of the other municipalities. So I will continue to beat that drum or ring that bell, as we say, and make sure we're still in the queue.
Justin,
Okay.
how likely is that, do you think, that it'll actually come to fruition?
Oh, I think it should be good. I mean, we really did a lot of legwork with the speaker's office. It's her priority. I know some other cities went out and did it on their own somehow, but I think the work we put in there with her office and with her specifically, we were certainly a key to that proposal. And it was unfortunate that that got lost in the walkout as well.
But that's in the queue. I mean, she is planning on moving that concept with the various community funding targets forward.
Yeah, I will talk to some of my colleagues. I haven't been through the bills yet, and the filing deadline of the 25th today. But we will see how she plans on packaging that or where it shows up.
Okay, great. Would you let us know, Justin, by email? I think everyone would like to begin tracking that as soon as possible.
Yeah, Nikki will be putting all that stuff together for everyone. So we will get it to Courtney, and then she will distribute to everybody.
Great. Well, I think highlighting that so we don't have to try to find it. Is it there? If it's not, what are we going to do on the quickly to get it back in if it's not there? I think that's a very big deal to us, is trying to get that low barrier shelter going.
Definitely.
If you'd like, we can be crafting our legislative updates to really focus on the key priorities that you've all directed us to try to fund, those being drinking water, which we feel confident about, the Navigation Center, COVID recovery resources was another one that we wanted to pursue, an equitable distribution, and also ensure that there wasn't any fluctuation in existing revenues that we rely on to backfill for COVID recovery. And then mental health resources was another priority. So we can shape our updates in your packets to really focus on those issues and then do the other bills. Okay.
Yeah, it's making sure those are right toward the top. But I think the one we didn't get because of the walkout is one that I think we're really going to be tracking very, very carefully.
And I think, Mr. Mayor, with the overlay of equity and how these types of policy issues negatively impact communities of color, et cetera, I think it would be a good synergy to kind of really see these things move. I think that overlay is going to help us in this situation.
Well, keep us posted if you need data on developing a very clear equity defense of what we're proposing. We can certainly work on that. Tom?
Thanks, Mr. Mayor. I want to talk about the liability workforce, the bottom, the last paragraph of what you said, and I see something happen on the 22nd. This also relates to COVID and COVID recovery. I know from my friends on the other side of the bar from workers' comp that I practice, that there is a big push to make it a presumption that if you get COVID and you have certain, I don't know all the details, but if you get it with and you have certain conditions at your workforce, it is presumed that you got COVID on the job, as opposed to getting COVID at the grocery store, or let's say at a religious celebration at a riverfront park.
Or at the Capitol.
Yes.
In a demonstration.
Any place. So, there are only two presumptions in workers' comp law. One is if you're the firefighter's presumptions, what the deputy chief knows. The other is a new one that is if you are a law enforcement officer, a first responder, and you have a mental condition, it is presumed to be based on your work. And this would be a third one. If you have COVID, it's presumed to be based on your work. And, I think the city I'm sure you can rebut it by saying, here's the steps that the city is taking. But I'm sorry Marcus isn't here, but I think we ought to follow that pretty closely.
Okay.
Thank
you, Tom. Any others? You guys I know mental health is a huge deal to us this round. We're very, very concerned. We met on the question of a CAHOOTS type program And clearly, one of our primary obstacles is lack of an infrastructure to deal with kind of where do you take people. And that one is going to be one that we, and particularly as it relates to mental health crises and addiction crises that our homeless community is facing. We're going to be looking closely at that and watching it. And right now, it's fairly clear capacity at the city level is going to be a challenging problem. So we'll probably be talking about what can we do at the state level to develop particularly mental health facility capacity for people in crisis.
And Justin, I think from a strategic standpoint, you could wrap that into the law enforcement reform discussions. That's sort of how we're approaching it, because it really is a fundamental part of police reform, is having somebody other than the police equipped, trained, and available to do those jobs that really aren't law enforcement. And so it goes right in with both of those things, mental health and with police reform.
Excellent.
Yeah. And in fact, that would be the absolute best target bill for us, or bills, whatever that package is starting to look like is. And I assume for most cities, it'll be if they are looking at police reform of the type we're looking at, which is alternative interventions. You just got to have some place for people to go besides just sitting on the side of the street with a brief counseling session. We really need something a little more aggressive.
And to dive down a little further on that, Councilor Hoy, I mean, that's also taking the burden off the officer if we have other resources.
Right. So it frees up law enforcement to actually do law enforcement functions, things that, they're often not able to do because of time. And it leads to a better outcome for the individual, which is really the ultimate goal, is to have better outcomes for our residents. When you have a mental health professional dealing with a mental health problem, you're much more likely to have a better outcome than if you're having a law enforcement officer deal with a mental health situation.
But it is a facility problem for I think a lot of us to figure out where do they go if they need intervention beyond a hi, how are you? Can we talk to you about what's going on here?
I think if I can just add really quick, I think it's a both and. We need mental health specialists, qualified mental health specialists, and we need places to take people if they need to sober, they need to detox, or they need mental health services. But I think we heard pretty loud and clear at our recent police work session that the police don't want to be necessarily in this business either, especially when they're responding to non-criminal activity. So we need those personnel. We need the people to do the work as well as the facilities. And I don't know if there's a way to roll that into something larger, but I would assume other cities have the same exact request.
Yeah, and I think it's really understanding where the money's going to be going as they start looking at these police reforms. What kind of money will they have? Will it be available for staffing? Will it more like my prejudice is they'll look at a facility question quicker, but will they help us out with these issues?
It's not like there's a lot of state funding for law enforcement at the local level. There's none. So it's not like there's something they're going to be redirecting. These are, so I don't know, Justin, if you have an idea about that, if somebody's bringing money to that table, but I mean, if they're just looking at policies, like directives, rather than, helping us actually solve the problem, that's not going to be very helpful.
And to add too, we definitely don't want to get in the position where we have all these capital improvement programs and then we have no operational resources there either.
Right. We've been there. We've got one with the sobering center. And what clearly happens is they will help you with facility. They really clearly have difficulty moving toward sustainable staffing at the local level or replacement staffing.
And I think one of the
Be
keys
interesting.
on this, Justin, is that, you know, money for mental health and substance abuse treatment typically flows through counties. And so there is a mechanism there in place, and I think there's an opportunity, especially with Medicaid dollars and other things, to beef that up. But the trick is to have it be dedicated towards these kinds of programs, so it doesn't, you know, come to the county and then we never really see the outcome or the result of that money.
Yeah. So good luck. No, it really, I think Chris described really well what that looks like. Is we're going to be somehow in a situation with how counties pass money through.
Right.
Well, don't. I mean, you know, or don't. And how do we, in that reform, how do we find a mechanism to push it through rather than have it get locked into their system?
Right.
Do we have any, I guess question for Justin, do we have any, I don't know how to describe it, natural partners in this effort at all for approaching legislators about the issue? I mean, besides, I guess, besides Marion County, are there other cities or I don't know, anything like that come to mind?
No, I think it's a good question. Courtney, I mean, obviously we've got a decent relationship with Marion County and your counterpart. I know you work well with Barb. So, you know, and between the league and the association, I mean, we've got a lot of partners that I think are going to be going down the same road here, but I don't know specifically.
I wonder if Debbie wants to just chime in for a minute about whether or how there might be some support as well from police and chiefs of police and those associations.
Well, and also if I could just slip in real quick before she does, I think, Justin, a regional approach to this could be really effective. And we already have some history with that. And maybe Lieutenant Aguilar would like to speak to that in terms of, you know, our behavioral health unit and that kind of thing. That to me, that we kind of have the framework of a model in place that's not city specific, not Marion County specific, but a little bit more regional. And that, I think that could be a great framework for you.
Yeah, so Courtney, you wanted to know, based on the OACP, whether they would support, are you talking about just like the Cahoots type program?
I'm curious about what you're hearing, because I do recall, and I feel like it was last year when Cahoots, the model was really being pushed in Portland. I think that there was some disagreement on the part of one of our communities. Maybe it was the firefighters who were a little concerned about equitable distribution of work, that they were going to be losing some of their work. But I'm not hearing that from our local firefighters, and I'm not hearing that from our local police. But I wonder if you want to chime in, and then I don't see, oh yeah. And DC Hadley, if you want to just chime in after Deb, please.
Yeah, I was going to say Hadley can definitely talk about the fire side, because from the police side, we absolutely support a Cahoots model, because like Councilor Hoy said, it absolutely, the calls that Cahoots responds to are not, they're generally not crime related. They're somebody sees somebody laying on the street and they're concerned because they appear intoxicated or they appear like they need medical help. But it's, so they generally will call dispatch, and dispatch will send a fire unit and a police unit. And then other than taking the individual to the hospital, there's really no other option for us other than maybe if there's a bed available at a shelter and the person's willing to go. So if you could just cut the police right out of that equation, because it's not criminal related, then again, like he said, it frees us up to go handle the crimes and investigate those. So we are absolutely in favor of a Cahoots model. But again, like it was pointed out, we recognize that right now we don't have some place to take these folks. So getting a Cahoots model is great, and if you get the staffing, but then where do you take them other than the hospital? So I don't know if DC Hadley has some thoughts. I think up in Portland, the concern was if you have a cahoots model, how does that work in relation to fire often responding to those calls and providing that triage to those patients to determine whether they need to go to the hospital or whether it's a mental health condition. So there might be some concerns there, and he can certainly talk to that. But as far as on the police end, and I believe I haven't heard specifically whether Kevin Campbell with the Oregon Association of Chiefs of Police has spoken. I don't recall if he's spoken specifically about cahoots, but that certainly is a topic trying to take the police out of areas like that, social service areas where we don't necessarily need to be responding. So my interpretation of what I've heard would be that OACP would be in favor of that kind of program. So yeah, I don't know if DC
Thank
Hadley
you.
wants to chime
Thank
in.
you. Yeah, thanks, Deb. Greg, do you want to weigh in, please?
Yeah, I'll be brief. I think from the fire perspective, obviously Eugene has this model. It's worked down there, and the relationship with fire has worked. The concern, obviously, the fire union would have would be taking away workload. But as we've evaluated this, really the key is the progression of the triage. So if that call is coming in through the 911 center, there doesn't appear to be any medical need. It's more of a mental health need. Cahoots can be sent out there. However, they staffed up the Cahoots model. Most likely somebody on scene would be able to evaluate if it truly is just mental health and they need a ride somewhere, whether it's detox, whatever it may be, that isn't going to be an issue. Where we start running into problems, and we run into those problems too with the state rules in regard to transport, is if the individual has a medical need and is in need of medical care, the Cahoots unit couldn't just throw them in the ambulance, treat them, and take them. That would be a violation of the state. It has to be an ambulance that does that. So this is easily workable on our end. Really, the key is the triage component of it, whether it's through the 911 center, even if we sent a fire unit out because it got mistriaged and they got out there and realized there was no medical need, they could call for a Cahoots and provide the care that way or the transport that way. So I guess what I'm trying to say is there really isn't pushback. It's just a matter of how we develop the model so that it doesn't violate anything at the state level with the transport itself. And then just having a good model to be able to triage calls to make sure that the right people are being sent in the right unit. So I hope that answers your question, but it's really something that we have been able to discuss and sort of work our way through. So if it does come to fruition, we could make it work.
And the transport issue you're saying has a state component. Does it have a contract component with Falk? I mean, do we run into any state mandated requirements, or can we deal with all that okay?
Yeah, again, when it comes to Falk, if it's somebody that's evaluated that does need, I'll give you a quick example. So we get out there and the patient is altered. We don't know if that's a mental health condition or it's a blood sugar problem. The minute you start evaluating based on the blood sugar and that, you're going to have medical personnel there from an ambulance. If it's determined that it purely is a mental health, there is no medical treatment that's needed. There's no violation at the state level. Falk isn't going to be upset because, again, it's not really a patient at that point.
Okay, sounds good.
Okay.
Thank you. I did want to, sorry, I'm going to make a really hard pivot. I apologize. I feel like this has been a great conversation and we've got a couple of natural allies and we'll continue to work the issue, but I do want to make sure that we have a moment to address the water system impacts on from the wildfires. And I know that's an issue that top of everyone's minds. And I just wanted to make sure, Jason, I'm going to ask you to speak. So make yourself available, please. I just wanted to make sure that everybody knows there has been a task force set up. Jason is on it. We also have Lacey Gores from a drinking water perspective and Anita Panko from a stormwater perspective. So we are engaged. And Jason, do you want to give everyone the context? So we have three bodies. That's great. But you want to explain?
Whose task force is this? Is this a state or a county?
Jason?
It appears it's hard to say. The task force itself hasn't really convened yet, but it appears to be running through Marion County. What I do know is that the Oregon Association of Water Utilities has just recently completed a damage assessment on all the systems in the canyon, and so we're still kind of waiting to see the results of that before we know what the next moves are going to be.
Okay.
But we do know that the water treatment plant at Detroit was completely destroyed, and that there's significant damage, at least initially, from what we can assess, to all of the systems, water and wastewater systems. And septic tanks is really going to be a big issue. I was on a call with Marion County just last week when they were talking about trying to ease some of the requirements to get new septic tanks permitted when they rebuild some of these structures. And as you know, also the North Santiam sewer project is still moving along. And that kicks off next week. I'm involved on the technical review committee for that. So that one's going to be interesting. I'm not sure what direction it's going to head now. I know that Commissioner Cameron is on record saying that now that he hopes that federal money will be flowing into the canyon, and that will be enough to go ahead and put in that sewer system. So obviously we're there just to make sure that this system, if it's built, is built correctly and is not directly discharging to the North Santiam.
Well, it's not just, I hope, I know this, Jason, but I want to make sure to say it is not just built correctly, but it will be a structure that's sustainable. We're not going to have one that 5 years from now potentially fails into our water supply because they have failed to raise the necessary funds to maintain a system for the really long term. They don't seem to have a plan for that. I get the run a pipe, how straightforward that can be, but to run the pipe and keep it running over decades is a whole different problem. Don't seem to come to grips with that one yet. The other that I'm concerned about is the cleanup strategy they've got for all of that riverside and nearby property. Have they got yet a cleanup plan, or is somebody going to be in charge? There's a lot of junk going to go into that river.
Right. So the county is calling in their contractors, their solid waste haulers, and they're putting a plan together. They're working through some contracting issues right now, but it looks like that should get started next week. One thing I will mention is we were contacted by the North Santiam Watershed Council about some areas of concern. So if you can imagine the amount of materials that's burned, and think about things that are in your shed out back or in your garage, and this type of material has gone onto the ground and the rains are going to wash it down. So and I think Robert and Peter are going to be bringing an informational report to council. I don't know if it's going to make it definitely won't make Monday's meeting, but probably the next, to go over some of the details. But essentially, we've given the North Santiam Watershed Council a $50,000 grant to pursue some erosion control measures along the stream banks and around some of those prone areas that we anticipate getting a lot of runoff from.
Good. Chris?
Thank you. So Jason, just to back up, when you first started talking about this task force, I guess in my head assumed that we were talking about water quality, our water quality, and you're talking about water systems in the small communities that were impacted by the fire. Is there going to be any discussion about, I mean, like we just kind of got into the topic a little bit there, but about I'm not talking necessarily about runoff, although I guess ultimately that's what it all is, but are we going to be talking about impacts to our water and what to do about that, if there's any need, if there's anything to be done? And I guess my question is, why would another task force be talking about that if that's the case? Why would that not be our conversation?
That is going to be that has been part of the conversation, Councilor Hoy, and it's something that we will be pursuing. I know between us and Eugene Water and Electric with the fires on McKenzie, we're actually talking with researchers at Oregon State University and their forestry department to start, looking at some opportunities to start collecting some data. They have a lot of expertise, as you can imagine, in forest fires and the long-term impacts. And they were showing us data yesterday of a fire that they've been monitoring, a fire scar they've been monitoring in Colorado that is still producing impacts to downstream water users after 17 years. So we're going to take advantage of this opportunity, if you will, to collect some good data and to get some of this fire analyzed to see what it's going to impact for us. And as Peter would tell you, even though we had a very benign algal season this year, the ozone plant is going to be a very good weapon against whatever we're going to see coming downstream in the next several years. And if you remember back to the B&B fire, which was in 2006, about 3 years later is when we really started seeing algal issues in Detroit Lake. We anticipate that this is going to rear its ugly head probably next summer and they're going forward.
Yeah. If you've studied like the Tillamook burn at all and the impacts, for instance, just on the fishing industry in Tillamook Bay, it destroyed salmon runs, it destroyed all sorts of things for decades, because of the silt and the runoff. The salmon didn't have the opportunity to hatch normally and that sort of thing. And so we don't even know what all the impacts could be, but I hope that there's some sort of bigger conversation about that, because we really need to, that's not a problem we're probably going to solve on our own.
Correct. Yeah, it's going to be, from the people I'm talking to, it's going to be a very regional collaboration between the three. I mean, if you think about the three main watersheds, the Clackamas, the McKenzie, and the St. Anne both experienced quite a lot of devastation. So there's going to be a joint effort, and we're going to be relying on a lot of the research expertise that comes out of Oregon State to help guide us on this.
Great.
Well, and I hope too that as they talk about federal dollars and spending, we don't get lost in the discussion of 200 people in Detroit, or maybe 1,000 people running down the canyon, and the drinking water of 200,000 people at the bottom end here in Salem. That this really is our issue, not Detroit's issue, ultimately. I really think I know I've been pushing back pretty hard with Commissioner Cameron on this, that I'm really, really concerned that this will get ahead of itself as he looks at economic development and we look at water quality. The two may not mix well. I hope we keep a strong stand. You can say almost anything you want, Jason, to just push back on these guys, because sometimes catching their attention, I'm finding, is very, very difficult on these environmental issues. So
yeah, well, I'm a little concerned about that because, as you know, in disaster recovery, sometimes environmental issues get pushed to the side in the name of economic development. So we've got to really stay strong.
And if the state is going to have a wildfire committee, I hope we are right front and center with our interests, which are the drinking water of what'll be well over 200,000 people over the next couple of decades, and the impact of this. I think we really have to be worried about this, and who's in charge, and what the strategy is, and how the governor is responding. If she's trying to do something within a month, she may be moving a little faster than, you know what I'm saying. They feel like they're a little disjointed. As I listen to the voices that are contacting me, it feels real confusing.
Yeah.
And I worry that they're not taking everything into consideration, like us.
I have confidence in Jason.
No, I just think we need to make sure he understands he has absolutely our confidence to push back very hard on our interests.
I don't know if he needs all that help. He's good on his own.
I will
be twice as rough, whatever it takes, Jason.
Oh, no, not with me though.
Let somebody tell you that you're trying to stop economic development in the canyon. That's not our issue.
Right.
Listen to that now for about a half an hour about how we'll be the bad guys. And I've tried to explain bad guys to 200 people as opposed to devastating to 200,000 is an easy equation to figure out. Anything else?
Well, I have one loose end that I want to make sure I close with you. There had been some conversation and concern about whether or how we could, we all hear in our communities, we hear the perception that because we are the home to so many mental institutions that we have a disproportionate impact as people are leaving those institutions. And I just want to say the data that I could get from the state hospital does not really bear that out. And I think I've had a similar experience when I've made inquiries about correctional facilities, and I just want to this is the source that it is, and we cannot show that with any clarity. So, for example, those who are committed, the county that they reside in when they're committed at a mission is for Marion County, it's 10.5%. And then as they're discharged, it's 10.3%. So there's no real evidence in the data to bear out what we are seeing and hearing and knowing as anecdotal evidence. So I'm sorry that that's where we are, but I just want to make sure that everyone knows I did inquire, I did get the data back very promptly, and it's not really bearing out what we experience. So
we heard that in the debates that would go on over the past couple of decades over group homes. I mean, it was just that went quiet, I guess, because they probably stopped funding group homes, but put them on the street instead. But yeah, I think you're right. That often is a misperception. It's the perception too that all the money goes to South Salem and none of it to North Salem. I mean, there are kind of cooked into the discussion in Salem some of these issues that are difficult, but I think we have a responsibility to look at that, like you're doing, look at the data and be realistic. But that doesn't mean we don't need facilities here to help us work our way through some of the real difficult times folks are having.
Everybody, I'm sorry to interrupt. I got to jump off. I'm sorry. I have a 1 o'clock work meeting to get to, but thank you.
Thank you.
The only other update I have is just that I want to make sure that everyone knows that we're being really active in pursuing support and funding for Yaquina Hall. Jessica's not here with us today, but we are doing regular conversations with DAS to further that. And Kristen Rutherford and Nicole Utz are in those conversations. So I just want you to know that we are actively pursuing closing of the funding gap for Yaquina Hall. Are there any other questions or topics of interest while we have everyone together?
More money, whatever they got. Paper said they had more money this morning, so that was a challenge for you, Justin.
We want it.
For the paper to do a correction, one or the other.
Yeah, we'll reach out. Rayfield and Johnson, those are our keys, along with our good Senate President.
Okay.
And Steiner Hayward too. She
is Peter pretty secure in being president for another term?
I haven't asked him that direct. Let's just say I've got a 4.5-hour meeting with the majority leader next Friday.
Oh.
So during that 4.5 hours, I will get a good sense of what the caucus is going to do.
Okay, good. Well, that's real important.
I should get a good sense of him, what's going on there with everybody within the caucus. So.
Okay, very good. Anything else, you guys? So we're going to just continue on with our legislative priorities, and then hopefully we kind of pressed home what some of the priorities inside the priorities look like for us.
Yes.
Okay.
We have some great guidance on how to shape and form the strategies and the issues as we continue those conversations. Thank you.
Now, if you need us together again, I think we can give you at least on a regular basis a sense of what the community is feeling or thinking and the council is feeling and thinking on these issues. So don't hesitate. We just love getting together.
I think we are. Currently, we just have a standing meeting once a month. And we'll keep that cadence unless we need to speed up because of some legislative movement.
Okay, good.
I would also say on just a final note that maybe I did or didn't hit in our opening. I haven't heard yet whether, I think it's all in the air, whether it's going to be in person or not. I think the legislature itself has a real issue about public involvement. with all these Zoom meetings and hearings. They also have a logistic issue of not being able to do as many hearings online as they would do in person. And as folks know, they go in and out of hearings quite a bit. So I don't have a sense of that yet. And I think it's important for us to get together to figure that out, because the good news is we're leadership centered in terms of focus, right? So we got the Senate president, we've got the majority leader in the Senate. We're good with the speaker. We're good with the Republican leader. I just think if we're online, it's going to continue to be leadership focused. Betsy Johnson, as I mentioned, Rayfield, those co-chairs of Ways and Means, as well as the legislative leadership. And I just don't know how that's going to look yet. We're seated well because we've got good relationships with all those leadership positions, but I just don't know how it's going to play out in terms of us putting input and us being there. Now, between Jason and Peter on some of the wildfire and the water and all that, we are a resource. And again, I want to, we talked earlier in one of our legislative committee meetings, we want to be more of a resource since we are so close, and do those, continue to do those relationship building opportunities with our own regional legislators. But boy, until we get a real sense of what's going to happen here in person or continue to do online, I just don't have a clue yet. I wish I did, because I think we have a real good strategy of getting individual counselors with legislators, et cetera. I just don't know how that's going to play out yet. So I want to make sure that everybody knows we're still trying to do that. It's just, what's the format going to be like?
Okay, well, keep us posted.
Okay.
Great. Again, thank you very much, and to the staff as well. It really, I'm very, I tell you, just personally encouraged by what Jason had to say. I'm really, really worried about this environmental hazard up the canyon right now, and what the leadership looks like around that at the county and state level. I'm just not sure they're seeing it right yet. So just keep driving that one home, at least from my perspective. And this need for facilities is no joke. We just are going to have a heck of a time moving forward on police reform that we think is important, like a CAHOOTS model, without some assistance in that area. So great. Thank you very much.
Thank you.
We're adjourned.
Thank you, everyone.